The CDC estimates that 1 in 54 children have autism. For these kids and others with special needs, access to learning services is vital. But with COVID-19, many of those offerings are stuck on pause. Good Wednesday evening, everyone. I'm Tyler Lopez.
And I'm Amber Kriska. Thank you for joining us tonight. Caitlin Pearson is digging deeper into how organizations and families are tackling these challenges in tonight's top story.
The new realities of 2020 have been difficult for everyone, but for the approximately 8,000 children in Central Illinois expected to be living with autism, this year has brought its own set of challenges. For Brad Davis, when it was announced that school and other programs would no longer continue in person this past spring, he immediately thought of his 6-year-old son who has autism.
Not only did the school-based rigidness of his daily activities stop abruptly, but also the therapies that he needed in order to continue to progress with his disability stopped abruptly as well. So being with other kids and being able to see how they act in certain environments is absolutely crucial. And the fact that that has all but gone away has been difficult.
For children with autism, virtual learning doesn't always click. Danica McGandy is Chief Operating Officer of GBC ABA, a therapy center for those with autism and special needs.
Knowing that so many kids were going to be losing those opportunities to work on social skills, transitions, and other school readiness skills, we really started to consider if we could be able to offer that program safely this year.
Another problem, personalizing education outside the building. The regional director says in a traditional school setting, these students often have IEPs or 504s, specific programs that were hard to translate in the virtual platform.
Wanted to be a resource for our families, so we did offer some additional therapy hours where we were able to focusing on those interfering behaviors. So if a kiddo was struggling to sit through a lesson, we were working on sitting for an extended period of time or looking for any way that we could support through that.
And it wasn't just the kids and families that needed help adjusting. Therapists also couldn't go to a child's home due to COVID-19 worries.
Working with all of our clinicians to navigate through any challenges that come up during telehealth. Like one challenge we've had, of course, is kids figure out that they can just shut the laptop off and then they don't have to have therapy. So we've worked really closely with families to navigate that as well.
But a big concern with the pandemic has been a delay in diagnostic services. Holly Swearingen, the nurse coordinator for the Autism Collective here in Peoria, says even before COVID-19, wait lists were up to 18 months, even longer for those on Medicaid. They're certainly not any shorter now.
The sooner that we get essential services and therapies in place, and the sooner that we understand why certain individuals may need the support that they do or how to provide that support, the more higher their outcomes are going to be, the more they're going to be able to achieve in life, the more independent they're going to be.
Brad Davis says unfortunately the pause on his son's therapies did lead to some regression.
I have no hard data that shows that, but you can just tell as a parent of some of the things that you were getting really close to are all of a sudden far away now. You know, it's the old 1 step forward, 2 steps back sort of thing that you wanna avoid.
But he remains hopeful that with groups like the Autism Collective and Central Illinois Autism Association, that more services will become available and kids like his son will have a bright future.
It goes down to just be kind.
Reporting for 25 News, I'm Caitlin Pearson.